In this video, we are going to be diving into the most overlooked reason for neck pain that could be affecting millions worldwide. Stick around to uncover the surprising and mostly unknown culprit and find out how you can finally find relief. Let's get started. Hi, my name is Dr. Frank Altenrath, and I'm a corrective care chiropractor at Valley Optimal Spine here in Cresskill, New Jersey. In this video, I'm going to discuss the absolute most ignored reason for neck pain. Whether your neck pain is from disc bulges, disc herniations, muscle tightness, arthritis, whether you've been to an orthopedic doctor, another chiropractor, a massage therapist, physical therapist, I can assure you, you probably have not had your spinal alignment and your spinal curves analyzed properly or categorized properly so that the proper treatment can be applied to your condition. So the research is clear on the importance of maintaining a proper neck curve, as well for that matter as a proper curve in your thoracic spine and your lower back, your lumbar spine. We should have a nice lordosis in the neck, a nice kyphosis in the thoracic spine, the mid-back, and then another lordosis in the low back. And just like blood pressure and heart rate and blood sugar levels, we know that there is a normal range that we want to be in. Ideally, the spine would be at a 42-degree curve, but we found in recent literature that we want to see patients that have a curve in the neck of at least 20 degrees. Under 20 degrees, we start to see a lot of pathologies occur, whether it's headaches, dizziness, all different types of pains, the propensity for having herniations in the future. So we want to make sure that that cervical curve is in the mid to upper 20s, if not better based on your anatomy. So I just want to show you what a normal curve looks like. This is a poster from CBP seminars, and it shows you a normal neck on the right and a degenerated or abnormal neck on the left. And if we notice on the right-hand side, we see a nice curve where the green line follows the path of the posterior longitudinal ligament. And so we have software that'll measure the degree of that curve. And as I said, we want to see people ideally in the 40s, but we want to see people in the mid to upper 20s minimum to have a healthy neck. When you have that type of curve, the weight is distributed evenly throughout the spine. So we have normal healthy discs that we see here in this spaces in between the bones. We see that we have normal bones, nice and smooth edges around the bones. And again, as I said, we have that nice normal curve. As we start to lose that curve, we start getting abnormal loads, abnormal pressures on the spine. That starts to cause things like decaying of the disc, where you start noticing the disc space is getting much narrower. We start seeing bone spurs where the bones start to lose their nice square shape and become abnormally shaped, and you start seeing spurs coming off the edge. You also start seeing the disc spaces get narrower in between the vertebra. So these are things that occur because of loss of curve, whether it's due to an injury, poor posture, anything like that. So that starts to cause abnormal pressures, which then causes all these things that we see here in this poster. So there are about 7 or 8 different types of curves that present in practice. The first one is a normal curve. A normal curve should be, as I said, we want to see people in the high 20s. We want to see that the angles between the individual vertebrae are even. So we should have an 8-degree angle between C3 and 4, 4 and 5, 5 and 6, 6 and 7. At 10 degrees between C2 and 3. This is because the cervical curve is modeled after a circle. So each segment should be contributing to the arc of that circle evenly. When we find the abnormal curves, we find things such as a straightening of the curve. We have hypolordosis. We can have hypolordosis with anterior head carriage, meaning that the head is the spine has lost its curve and it's also moving forward. We have different types of S curves where we have too much of a curve at the top and we have loss of curve at the bottom of the neck, or a reverse S curve where we have flexion at the bottom of the neck and then we have a curve at the top. So it forms an S shape. We have curves where there are too much of a curve. We have a hyperlordosis. And then we also have complete reversals where the entire neck has just gone into a kyphotic position like this, where it's not even straight anymore. So it's completely kyphotic. So now I want to show you from the 8 different types of presentations that we see with people's necks. I want to give you some real life examples of patients of ours that have some of these categories so you can see firsthand what we're talking about and why it's important to be able to categorize the type of curvature they have so we can treat it a specific way. So follow me. So the first example is an example of a type 1 where we have an anterior translation with loss of lordosis. So again, if we look here at a normal curve, we have each vertebra contributing evenly to the curve as the arc of a circle would be. And on this side right here on the right, we see a loss of curve. The spine is straightened out and it's moved forward. So that would be a hypolordosis with loss or with anterior translation. So with loss of curve and the spine has moved forward. So in this next example, we see a type 2 curve where we have a loss of lordosis, loss of curve, with slight head translation. So in other words, as the one before, the head was going way in front of this green line. Here we see loss of curve. We can see how much of the green line is straightened out and behind, the red line is straightened out and behind the normal green line. We have loss of curve, but the head is not translated that much forward. This here is an example of a type 3 curve where we have a kyphosis lordosis, or what I was talking about before with the S curve. We have a kyphosis up in the upper part of the cervical spine, and then we have a lordosis in the bottom of the spine. So we can see the bottom of this curve is matching the green line, but up top, the patient has gone into a kyphotic position. This was due to an injury. It's a sort of a buckling, a snap-through buckling, where there was a force applied to his head. When he was a child, he had a head injury, and it buckled his spine into this S-shaped configuration. In this next picture, we can see a type 4 curve, which would be an S curve as well. We have kyphosis at the top and lordosis at the bottom, but we can see a significant translation of the head forward, which is over 23 millimeters. So that's the difference between the last one, where he had an S curve, but the head was not translated forward. This one, we have a translation forward. So we can see the red line, green line. Red line is how far forward the head has gone compared to the green line. In this picture, we see a loss of curve, but we see major anterior translation of the head of 60 millimeters, 60.4 millimeters forward. Now the maximum the head that can go forward is 75 millimeters. So with this patient, he's already more than 3/4 of the way there to his maximum range of motion in the cervical spine. So the question becomes, why does it matter? Who cares what the curve looks like? You showed me 3, 4, 5 different curves. Who cares? Well, I'm going to let you know why it matters and why you should have your neck looked at. I'll use an example of someone we just saw before on an x-ray. I'm going to show you why it matters as to what type of curve we find. So getting back to our x-ray from before, we see a normal image on the left, and we see this patient here who had a loss of curvature in the upper neck with a lordotic or curve in the lower part of his neck. So we need to apply the treatment to the upper part of his neck to restore that nice curve throughout the entire spine. So the exercises that we provide, that we give patients to do at home, as well as the specific adjustments and the traction, needs to be applied in the proper angle and proper level of the spine to get a correction. So let's show you a picture of how we did the traction on this gentleman to get this upper cervical kyphosis, loss of curve, back to normal. So here we see our patient who has that lovely reversal of his upper neck curve, and he's in one of our traction tables that we have, and we can see that this pulley here is pulling into his neck, in the upper neck, at an angle that goes to his upper cervical spine. This pulley here is pulling his neck up to distract, so we're getting a two-way traction. We're getting a traction up and a traction into his curve. but the angle into his curve is at a level that's going to reach the upper part of his neck. If we change the pulley lower, it would be pulling into the middle of his neck. If we lower the pulley more, we could pull into the lower part of his neck. But because his reversal is at the upper part of his neck, it's pulling in the upper direction to reach that upper C2, 3, 4 area where he lost his curve. So I hope, as you can see, that it is important for us to know when a patient comes in what type of curve they have, or whether it's their neck or the low back or the mid back, what type they have, what category they fit in, because all of our treatment will be specific for that specific presentation of what their spine looks like. If it's a high curve, high loss of curve, low loss of curve, we cater the treatment specifically for that spine. And the long-term results on these patients is that following patients down the road, studies show up to 2 years, when they get their spines corrected, their pain stays and continues to get better as time goes on, as opposed to just doing basic therapy where we do hot packs or electric stim or just adjusting. Correcting the curve is a big part of getting patients long-term benefits. So I hope you found this video informative, and if you are suffering from neck pain, or you have herniated discs, or you were told you have tight muscles and things just don't seem to get better, and you haven't had your spine looked at and checked out to see how your cervical lordosis or curve is, then I would suggest you find a corrective care chiropractor or someone that works with these spinal architectures can tell you specifically how your curve is, whether it's at 10 degrees, 20 degrees, reversed, not reversed, and then get it taken care of. If you need a reference, if you need another corrective care chiropractor in your area, we have a database of doctors throughout the world. So just leave a message down below in the comments, and I can give you a link to the CBP directory of corrective care chiropractors, and you just enter your zip code and you can find someone who's near you. Again, I hope that you enjoyed the video and that you got something out of it. If you did, you might want to hit the like button down below, tap the notification bell so you get up to date on new videos that we release, you get notified, and consider subscribing to our channel. Until the next video, we'll see you later.